All right. Hi, everybody. I am so happy you're here. Thank you for joining me for this webinar on naturopathic targets for IBS. I just wanted to say thank you so much for taking this hour for yourself and your health. Make sure you stay until the end because I have some awesome deals that I want to share with you that I will be offering for only the people attending this webinar. My name is Dr. Alyssa. I'm a naturopathic physician licensed in the state of Connecticut. I'm a graduate of Bastyr University, California, and one of my biggest passions is gut health and natural healing. So I just want to share that all with you guys. And so what are we going to be covering today in this webinar? We're going to be talking about, for the people that aren't fully familiar what IBS is, what is IBS and what are the main causes? How does the conventional model target these causes of IBS? And how does a naturopathic doctor target the causes of IBS? And so irritable bowel syndrome is generally a set of symptoms that a patient qualifies for if there isn't anything else found to be wrong with the patient. And so normally they're going to be having this reoccurring abdominal pain. And right here on this slide, I'm showing you the Rome 4 diagnostic criteria. So this is what your doctor will use to diagnose you with IBS. And so these are just some of the symptoms that they correlate with IBS. And so you're going to have to be having some stomach pain for at least one day a week for 3 months. And it's often associated with bowel movements and going to the bathroom and change in bowel frequency and the change in your stool formation. And so basically, these patients are having more either constipation or diarrhea. They're having pain either after eating or during a bowel movement. And they also can be experiencing some other symptoms like bloating. They also may experience anxiety, depression, nausea, or vomiting. They may also have some heartburn. And so with IBS, studies have found that up to 20% of the world's population suffers from IBS. That is a big amount of people suffering from a condition that they know very little about. And so these patients are often not taken seriously because there's no concrete findings. Like I said, there's just these symptoms that they see, but when they do labs and when they do imaging, nothing is found. And so, unfortunately, some of these patients are told that their symptoms are all in their head. And what does the conventional model do when they're trying to treat IBS? Most likely, they're going to try to rule out any other cause. And then once they don't find that, they're going to look more towards dietary causes. So that's where your low FODMAP comes in, which is just a fancy term for fermentable oligosaccharides, disaccharides, and monosaccharides. Those are carbohydrates. And so by eliminating some of those, they hope to decrease symptoms, which isn't always the case. They also look at lactose, which is that protein found in milk. And they may prescribe antibiotics if they think that there's an infection present. They also may prescribe probiotics, which may or may not help. And as a last resort, they do fecal microbiota transplants. And these handful of treatments are only effective in certain patients. And so naturopathically, what do we see is the common causes of dysbiosis or of irritable bowel syndrome? And we're going to be talking about a few of these in the next slides. So dysbiosis. What is dysbiosis? Many of you may have heard of it, many of you may have not. So this is an imbalance of the good and the bad bacteria in your gut. And so some research has shown that there's a more patients with IBS are more prone to dysbiosis, and that there's less of a diversity of the bacteria in the gut in patients with IBS. And how does this come about? Sometimes we see dysbiosis more commonly in patients using certain medications. So Advil and Motrin, your NSAIDs, the ibuprofen, those medications can cause dysbiosis. Omeprazole, which is a protein pump inhibitor used to treat heartburn, which many patients with IBS experience. And then birth control, which many females in the United States are on today, can cause dysbiosis. Another really big contributor is poor diet. When we aren't eating diverse fruits and vegetables and getting a big amount of fruits and vegetables daily, and if we are concentrating our diet mostly on processed foods, our bacteria isn't going to be set up for success because there isn't going to be as much variety and food for the bacteria to feed on. And so we end up seeing dysbiosis in the long run. Another big common cause is physiological and psychological stress, which we'll get into more in the later slides. And so why do we care about dysbiosis? What happens from dysbiosis? So we can have an overgrowth of the pathogenic bacteria. So the more bad bacteria, if you come into contact with some of these, they can end up taking over because your immune system and the bacteria in your gut isn't set up to fight off these pathogens or the bad bugs. It also puts you at increased susceptibility to ingested pathogens. So ingested bacteria like E. coli, and things that cause food poisoning. And then we also are more prone to SIBO, which we'll be talking about in a few slides. And then it decreases short chain fatty acid production. And what are short chain fatty acids? So short chain fatty acids are produced by the bacteria in our gut, and they produce this from starch. So they produce this from fibers and starch from our fruits and vegetables like bananas, potatoes, asparagus, lentils. And once they make these short chain fatty acids, they go and they bring it to the cells of our large intestine. And that is the food that our large intestine thrives on. And it helps increase the barrier and helps set our guts up for success for optimal digestion. It also helps increase the formation of the mucus barrier, an extra barrier that our gut has in between the food and the things we are digesting, and then the rest of our body, the inside of our body. And they also help set up antimicrobials, things that will kill off the pathogens that we come into contact daily. And so how do we know we have dysbiosis? How do we treat dysbiosis? So common symptoms of dysbiosis are altered bowel movements, so more constipation or more diarrhea. There's also more pain that comes with dysbiosis, stomach pain, and gas and bloating, which many of these symptoms sound like irritable bowel syndrome. And so dysbiosis is diagnosed mainly through a stool test. And if you have risk factors, like if you're using medication, if you're not eating a diverse diet, you may already know that you have dysbiosis. And so what happens after the diagnosis? We treat with the following. Antimicrobial herbs. We want to kill off the bacteria that's there in excess. We increase fiber to help the bacteria that's already there flourish and grow. We also use probiotics or probiotic-rich foods that help replace and bring in bacteria that may not be there present currently. And so SIBO, this is something we talked about a few slides back with dysbiosis. And so what is it? SIBO stands for small intestinal bacterial overgrowth. So this is the overgrowth of bacteria that are usually found in your colon, and then they move and migrate to the small intestine, which they are not supposed to be there. And so this ends up causing more symptoms like constipation or diarrhea and bloating after certain foods and after meals. And studies have shown that almost 50% of patients diagnosed with IBS actually do have SIBO. And that is such a big number. And they often go misdiagnosed because this is not something that the conventional model has fully accepted and fully started investigating yet. And so they don't often test their patients for SIBO. And how, once you find out you have SIBO, what do you do? So we really need to address the root cause. If you don't address the root cause, the treatment likely isn't going to be fully successful, and it's going to be a long run to feeling better. And so the root cause mostly has to deal with slow motility, like slow movement through your digestive tract, and being deficient in some of the things that break down our food. And so we also want to kill off the bacteria that is in our small intestine. So we're going to use antimicrobial herbs and things like garlic, thyme, oregano oil, and berberine. Those are things that are very antimicrobial, and some of those things we use every day, and that can help enhance and kill off bacteria. And we also are going to do a little bit more dietary changes, because for a certain amount of time, you want to set up your treatment for success, and you want to starve those bacteria that are in your small intestine. So you need to take away the food that they live off of. And so we also are going to do a replacement of the low and the missing components of digestion. So a replacement and supplementation of stomach acid and digestive enzymes. There's also been some studies on post-infectious IBS. So what this means is that after an episode of gastroenteritis, which is basically food poisoning, there's no evidence that there is any more pathogens in the patient, but there's still some lasting symptoms. They still are experiencing either constipation or diarrhea, abdominal pain. And many of these patients, after months or years, they end up being diagnosed with IBS, and they still are having these symptoms. And so what is going on exactly? So there's some low-grade inflammation that's causing the activation of immune cells, and that targets the cells of our colon, and it increases the permeability. So it opens up those barriers in our colon and in those cells that allow the movement of pathogens and immune cells into our body and food into our body that cause irritation and more symptoms, and it affects the barrier significantly. And so we also have histamine, which is a neurotransmitter. This is a neurotransmitter that's found in our whole body. It's found in the GI tract, and it's usually the culprit when it comes to allergies, food or environmental. And so when you have a food allergy, cells release histamine, and this is what causes those hives on your skin or the anaphylaxis reaction where you can't breathe. And so studies have found that certain foods or bacteria can lead to the activation of the cells that release histamine. So what does this mean? It means that there's a localized allergic reaction happening there, and histamine is responsible for it. And so this causes patients to experience more pain and discomfort in that area, in their stomach. And so studies have also shown that certain bacteria release histamine. So when these bacteria that you see right here, E. coli and morganii, when they're in excess, they will be releasing more histamine and causing more pain and more symptoms for a patient with IBS. And so studies have shown once you start blocking histamine, you can improve the severity of IBS. And you also can target those bacteria and kill off those bacteria to prevent them from releasing too much histamine and causing the allergic reaction. And take a look at your diet. Are you eating something that may be causing more reaction and more irritation to your gut? And so how do naturopathic doctors treat IBS? So one of the most important things is to establish the foundations for health. And we're going to go over that on the next slide. We also want to stimulate self-healing. We want to make sure that your vitality is strong enough and your body is strong enough to start healing itself. We're going to support and restore weakened systems. So what that means is we're going to support your digestive system. We're going to support other systems in your body that are going to help healing. And another area that I find very important is natural symptom relief. This is something, irritable bowel syndrome is very uncomfortable. Many patients experience constipation that leads to more pain, and without symptom relief, it's just going to be very uncomfortable and it's going to be a long road for them. And to give them that temporary relief while we treat the root cause can be very empowering for them. And so how do we establish the foundations for health? First, we want to investigate the root cause, which is likely some of those things that we discussed in the earlier slides. So is there dysbiosis? If there is, could it be SIBO? Are you one of those 50%? Is it a pest infection? Is it a histamine reaction? Those are some things that you would want to investigate to try to find the root cause. You also want to remove the obstacles to cure. So are you eating foods that are doing you disservice by not improving your microbiome? Are you eating more processed foods that may be causing more irritation to your gut? And are you chronically stressed that's causing you not to be able to heal? We also want to support sleep. Sleep is so important for healing. And if you're not sleeping and if you're not getting that proper deep sleep, you're not going to be able to function properly and your body is not going to be able to heal. There is such a powerful, your circadian rhythm and your sleep is so powerful that if you help regulate that, then your body will be set up for success. We're also going to look at diet, hydration, exercise. And diet is a really big one because, as you guys may know, with IBS, there is a lot of things and a lot of individuality on diet and what each individual can or cannot eat. So that is a very big area for patients with IBS. And so we really want to support those weakened systems. Like I said before, we really want to support the digestive system. But one system that I think is one of the most important is our nervous system. And so our nervous system is broken down into two major parts. You have our sympathetic nervous system, which is our fight or flight. This is when we're more tense and more stressed. We also have our parasympathetic nervous system, which is our rest and digest. So this is responsible for the contraction and the movement of food throughout your digestive tract. So if you are more stressed, you're going to be more in that that sympathetic state right here, like I said, you're going to be more in that fight or flight, and you're not going to be set up to properly digest your food. When you enter and start eating a meal and you're more relaxed and you're more in a parasympathetic state, then you're going to be able to digest your food properly. And studies have shown that there is a big correlation between IBS symptoms and stress, anxiety, and sleep disturbances. And patients with IBS are commonly found to have an increased sympathetic function and decreased parasympathetic function. So they're less in the state of rest and digest. And so this can be causing more issues when you're trying to digest the meal that you just ate. And so 3 things that I want you to do, and I have all of my patients and clients do. I want you to check in with your nervous system and check in and reflect on your past week. Are you always eating on the go? Do you feel stressed, anxious, angry, or all of the above when you're eating meals? Do you tend to skip meals or have random meal times? When you are eating on the go, you're more stressed, you skip meals, your nervous system is going to be more stressed. It's going to freak out a little bit because it's not sure when the next meal is going to be. So you're going to be more in that sympathetic or that fight or flight state, and you're going to be more stressed, and you're not going to be primed for digestion. And so what's one way we can help our parasympathetic nervous system? Biofeedback has been studied, and what this is a mix of relaxation techniques, mindfulness, breathing techniques, all to activate the parasympathetic nervous system, that rest and digest. And so it gives you real-time information, biofeedback. It gives you feedback about what your nervous system is doing. And it shows you things like breathing rate, and heart rate variability. And there are various practitioners that practice this. And so, is it useful for IBS? The studies are mixed, but there is some evidence showing that there's dysregulation in the nervous system with patients with IBS. And IBS is one awesome way that can help regulate the nervous system a little bit more and has been shown to effectively reduce symptoms. And right here is just one study that's been done on biofeedback and IBS. And I'll just give you the basics of this study just to show you how powerful relaxation and mindfulness can be on our bodies. This is a study of about 40 patients. They were separated into 2 different groups. And so there was a stress management group and a control group. And the stress management group had 1 session every 15 days where they practiced relaxation, breathing techniques, and progressive muscle relaxation for 8 weeks. So they increased mindfulness and meditation. And so the results were very interesting. So they had less perceived stress in their life. They had less symptoms and decreased symptoms of depression. They had more of a sense of control over their health. They felt more empowered in their body. They felt better and had less symptoms. And so how do you use this to your advantage? You can practice mindfulness-based techniques in your everyday life to allow yourself to feel more grounded in a more calming state to help guide your nervous system and help get you into a state that's more rest and digest, more primed for digestion. And so there's various nutrients that have been studied in IBS, and we're going to go over a few of them right now. And so one of them is vitamin D. Vitamin D, we know, is we usually get it from the sun, but we also can get it from food too. So salmon or egg yolks. And many of us that live in the Northeast right now during this time of year are most likely deficient. And so we know vitamin D plays a big role in our immune system, but what a lot of people don't talk about is how it helps maintain the environment of our gut. It helps maintain a balance in our gut and maintain the barrier between the outside world and the inside world in our intestines. And it also has powerful antimicrobial activity. And when you have a deficiency, like many of us may have right now, you have a weakened mucosal barrier, which is the barrier in between the outside and the food that you're digesting and the inside of your body. And then there's a lack in the protein that help make up the tight junctions, which are basically the proteins that are keeping the cells of the lining of your gut intact and together. And studies have shown that patients with IBS tend to have lower vitamin D levels. And once they supplement, the disease activity and their symptoms improve. We also have vitamin B6, which is a coenzyme for many reactions in the body. It helps break down fats and carbohydrates. It also helps with the breakdown of many neurotransmitters like serotonin, dopamine, norepinephrine, epinephrine. And so a patient with IBS may be deficient in this because they aren't eating the proper food sources for this. Patients with IBS, and as you may know, may only be able to have a handful of foods. So they may not be eating the salmon, the Russell potatoes, the turkey, the avocado, some of the common things with B6 in it. And it will deter their body from the breakdown of these things. And studies have shown that when there's an increased amount of serotonin, there can be more diarrhea, that people can be more prone to diarrheal symptoms. And vitamin B6 is one of those nutrients responsible for the breakdown of serotonin. And so studies have also shown that patients with IBS have low intake, and when they have low intake, they have worsened symptoms. And once they supplement with B6, then their severity of symptoms decrease. And so what can you do today? I want you to check in with your nervous system. Reflect on this past week. Were you more stressed? Were you stressed when you were trying to eat? How do you feel about this week? And then I really encourage you to begin a mindfulness-based practice because, as we talked about before, progressive muscle relaxation, mindfulness, breathing techniques are very powerful in helping support our nervous system, which is a vital part of our digestion. So by checking in and practicing more mindfulness-based techniques, we can help alleviate stress and prime our nervous system and our digestion. So I really encourage you all to start a mindfulness-based practice. And these things are so accessible these days. You can download apps like Calm or Balance, or even find a YouTube channel, a YouTube video that has meditations on it as well. And then I really encourage you to start investigating the own root cause of your IBS. No one knows your body better than you. And so by you starting this investigation, you can really help try to figure out what the root cause is. And I would do this by starting a diet diary. Do you notice any correlation between food and symptoms? And if you do, how do you feel when you don't eat that food? And I encourage you also to add some notes about emotions and stress while you're eating, and notice any correlation between those symptoms and those things that are going on and symptoms that you may be having for IBS. And I would really encourage you to do this not only for your body, but for your mind and your mental health. And so I want to thank you all for being here today. I really appreciate you taking the time for you and your health. And I hope you had something to take away from this talk today. In order to thank you all, I am offering a discount on my gut reset package. You can enjoy $50 off of my gut reset package, which includes an initial consultation, one-on-one visits with me, an initial consultation, and 2 follow-ups, just to keep you on track to amazing results. And in this package, you also get included comprehensive stool testing, so we can test to see how much inflammation or dysbiosis is present in your body. And you will also get personalized recommendations tailored to your needs and your specific results from that stool test. And you also can enjoy 20% off supplements through FullScript. And for those of you who aren't ready to take the plunge and for a gut reset, I am offering $20 off of a new client consultation. And so these are both things that can be purchased on my website. I will be sending out a code for you guys to put in the email today with this recording. Thank you all so much for being here. I really hope you learned something and had something to take away from this. I hope to see you again soon, and have a nice Thursday and a good weekend.